Okay, so we'll be looking at the various growth factors that actually stimulate hematopoiesis, or you could say that hematopoiesis. Okay, and hematopoiesis or hematopoiesis is basically the process that actually leads to what the production of what blood cells in the body. Okay, could it be red blood cells? Could it be white blood cells? Could it be lymphocytes? Could it be macrophages? Okay, the process of this formation of these cells is actually what we call hematopoiesis. Okay, and in this hematopoiesis we actually have factors that are stimulating or promoting hematopoiesis, and we also have factors that are what inhibiting hematopoiesis. You understand? All right. So on the basis of this, we'll be looking at the factors that actually stimulate, and they are actually what growth factors. Okay, they stimulate hematopoiesis, which is what the process of what blood cells formation in the body. You could see this picture. You could see this is the multipotential hematopoietic stem cell, and the multipotential hematopoietic stem cell can actually become a common myeloid progenitor or a common lymphoid progenitor cell. Okay, and this now you could see looking at this picture, you could see a lot of shorthand or abbreviated stuffs here, and those are basically what the growth factors. Okay, so the growth factors, you could see them, they can act at different levels of what hematopoiesis. You could see the granulocytes, macrocyte, colony, stimulating factor. Okay, it can act here, it can also act here, it can also act here. All right, so these hematopoietic growth factors, they are not limited to a particular stage. They can act at various stages. Okay, so talking about hematopoiesis now, we say that is the formation of blood cellular components which occurs during embryonic development and throughout adulthood to produce and also replenish what the blood system. Okay, so studying hematopoiesis can help scientists and clinicians to understand better the processes behind blood disorders and cancer. So, because of course, before you can be able to understand what a blood disorder is, before you can able to understand what a blood cancer is, you should know the normal, right? You should know the normal to actually be able to know the abnormal. Okay, so knowing this process of what hematopoiesis and the factors that basically stimulate or inhibit it will help you to know when there's a cancer or there's a blood disorder. All right, because these blood disorders can go down to actually be as a result of these stimulating factors and inhibiting factors. So we have stimulators that can actually work on the pluripotent cells. That's basically like they can act on the stem cell itself. Okay, and examples of it is what the stem cell factor and the interleukin 6. Okay, this is what the stem cell factor and the interleukin 6. Okay, we have other ones like interleukin 1 and interleukin 3. All right, but I feel like you should just stick with what we have in this lecture because this was directly from my professor. Okay, the ones that can act on erythropoiesis, we have the burst promoting activity and we have the erythropoietin. Okay, the ones that can act on erythropoiesis, you have the burst promoting activity, that's a BPA, is not listed here. Then we have the what erythropoietin. Okay, burst promoting activity, and we have the what erythropoietin. Okay, these are the ones that can act on erythropoiesis so that erythrocytes can be formed. Okay, all right, hope you guys are following up. We have other ones too, which you can take in consideration, or you could leave it like that. Okay, moving to the next, we have the ones that can act on what process of formation of what granulocytes. Okay, and that's basically the white blood cells that have a granule in them. We have the granulocyte colony stimulating factor, we have the granulocytopoietin, we have the interleukin 1, we have the interleukin 3, we have the interleukin 5. So let's look at granulopoiesis now. Granulopoiesis. Granulopoiesis. Granulopoiesis is basically the formation of these white blood cells. Okay. Now, I hope you guys are seeing them. All right. Now, for granulocyte, the mnemonic I actually used to know granulocyte is NEB. Okay. N standing for neutrophil, E standing for eosinophil, B standing for basophils. All right. So you can see this series of what? Series of growth factors that actually work on that granulocyte. Okay. Moving on to the next, we have the megakaryocytes. These are megakaryocytes, colony stimulating factor. Megakaryocytes, colony stimulating factor. Where are the megakaryocytes? See? Megakaryocytes. We have thrombopoietin, all right, TPO. TPO, it could be interleukin 3. We also have stem cell, that stem cell factor, all right. But in this lecture, we have it listed as what? Megakaryocyte, colony stimulating factor, and the thrombopoietin. Okay, basically the how will I put it? Basically the growth factors acting, all right. Then we have growth factors acting on stroma cells, all right. I think this is just like an overview of it. Stem cells, we have the stem cells, we have the interleukin 1 tissue necrosis factor. Okay. The other ones are acting on pluripotent stem cells. Pluripotent stem cells are the stem cell factor. These are the pluripotent stem cells. I think that slide is basically like just an overview. Okay. Then we have the ones acting on multipotential progenitor. This is like an all right. But this summary is not really good. I'd like you guys to actually go with what is here. The ones that we didn't listed out, you can use this image to actually write them out. Okay, the ones acting on eosinophils like this, the one acting on neutrophils like this, the one acting on basophils like this, the one acting on megakaryocytes like this, the one acting on erythrocytes like this, the one acting on myeloblasts like this. Do you understand? So that's it about the examples of growth factors that actually stimulate hematopoiesis or act on the hemopoiesis. That's it, guys.